I'm Dr. Papavassiliou. I'm a neurosurgeon and the co-director of the Spine Center at Beth Deaconess Medical Center. Today, we're going to talk about robotic spine surgery. Robotic spine surgery provides the surgeon with extreme precision. Precision leads to better outcomes, less complications, and less reoperations. The robot basically, it's a machine on wheels that has a screen that shows you the patient's anatomy, and then it's connected to the actual robotic arm that's at the patient's side, attached to the side of the table, and directs it to the patient. The robotic arm rigidly attaches to the patient, and from there on we proceed with the guidance of navigation and placement of the hardware. The question comes whether the robot actually performs the surgery. The answer is no. As you see over here, the surgeon is next to the patient, and the robotic arm, which is attached to the table where the patient is laying on, provides the accuracy for the surgeon to provide the hardware placement. Why do we select to do robotic spine surgery, whereas traditional methods have been overall very successful? So the big advantage of robotic spine surgery is that it allows you to pre-plan your actual procedure, especially in regards to the hardware placement. What robotic spine surgery in association with navigation is going to allow you to do is pre-plan the depth of the hardware it's going to be placed, the length of the hardware you're going to place, as well as orientation and angle of the hardware. It will allow you to plan the rods, the length, as well as the angulation of the rods. So this enables the surgeon to get a less traumatic approach to the patient. We achieve that by having smaller incisions, which will lead to less tissue damage, less pain, less hospital stay, and of course less infections, and definitely speedier recovery. What's the difference between robotic navigation versus the regular navigation that a lot of surgeons are being used to nowadays? The big difference is the precision again. Precision, predictability, as well as less intraoperative radiation. What the navigation adds is ability to look at the actual hardware while going into the spine. However, the robot adds the sub-millimeter precision, giving us accuracy rates of 97 to 99% compared to conventional numbers of 90 to 95%. What are the cases that can be done robotically? What patients are candidates for robotic surgery? Numerous back-related conditions. Degenerative thoracic and lumbar disease, traumatic injuries, and tumors of the spine. Overall, any type of surgery that requires hardware placement in the thoracic spine, plus minus the lumbar spine, will benefit from the addition of robotic navigation. So what has experience showed us? Why would the surgeon will want to use the robot? In just a few words, the robot makes the spinal fusion safer, easier, and more effective. Please feel free to contact us if you feel your patient will be an appropriate candidate for a robotic spine surgery, and we will be happy to schedule an evaluation.